I'm Dr. Anjali Chandrasekharan. I'm a Paediatric Ophthalmologist working at Pushpagiri Eye Institute. What is myopia? It is one of the refractive errors which we see in children. It is a condition in which the length of the eyeball length is slightly larger than the general population. So the rays of light which come from any object tend to get focused in front of our retina, which is a camera inside the eye, and that is causing a blur image. Usually in kids, by doing school screening programs or when they come to the hospital or clinics, we do an assessment of the refractive error. How much is the vision? How much is their uncorrected vision? And how much is the best corrected vision? And how much is the spectacle number they need? So usually myopes, the spherical number will be minus numbers. So that is simply called as myopia. It can be a spherical myopia. Sometimes there can be a small cylindrical number also. They are called myopic astigmatic. There are certain important genetic risk factors in myopia as well. If the children's parents are myopes, then there is a high chance that the child can develop this myopic error in a very younger age. And if the children's parents are having higher power, there is also a chance that the progression of the increase in myopia happens more drastically and more faster in the younger child. So it is very important that all the myopic parents, their kids in particular, need to be screened for early onset of myopia or for even rapid progression of myopia. There are a lot of issues when the minus number shoots above -6, which is called as pathological myopia. There can be something called as a myopic macular degeneration. These are all issues in the center part of the inner layer of the eye, in which the focus of the light happens, and they can cause vision loss, visual impairment. So we want to not go to a situation where most of our population, that is our kids, are going to be myopes, and later on in their age, above 40, 50, 60, they tend to have all of these problems. So we want to mitigate the situation. We need to get some lifestyle modification for our kids. So try to restrict the screen time of the kids, indoor time, especially on small screens in poor lighting conditions. That should be avoided as much as possible. Try to encourage the kids to go outdoors. So outdoor play time for at least 1 to 2 hours in daylight when there is sunlight. It will also help reduce the progression of myopia.